Yes.
Nikki, tell us, I know we've spoken a little bit about the hospital system, but tell us a little bit more about it, about the hospitals, and also about the unique culture, the power of one culture.
Sure. And I think we have some slides that
We
might
do.
help with that.
We, we'll be,
Um,
yeah, go ahead.
so, one of the things that Jill talked about is that we really serve all corners of our community, and we're very proud of that. And so you can see on that map that's there that we have 6 facilities, and they really surround the this area. Methodist University, and that's where Linda and Jameson work, is a hospital that has some special things that go on there. It is our hospital that does transplant, solid organ transplant, and they do the neurosciences there. So that's one of the things that are you that two of the things that are really unique about Methodist University is that those are the things where they specifically serve patients. Now they have all kinds of services. They have a medical and a surgical ICU. They have a CVICU for cardiac. They have med surge. They have step down. They have operative services, which is where Jameson works. So we have all of those things. So if you can go
Okay.
back to the slide, really with the different hospitals would be great. Thank you. Our Methodist South Hospital again is in our South area, and that is serves our community in the Whitehaven area, which is really right by Graceland. And again, they have all of those services: med surge, critical care, step down. Operative services, a lot of procedural areas, and they have labor and delivery and NICU at that facility. You'll see our North Hospital, and you'll see that magnet banner. All of our hospitals are on the magnet journey, and I know many of you work in hospitals that are on magnet journeys or are magnet designated. And our Methodist North Hospital, which as it indicates is in the north part of the city, again is our first community hospital in this area that was designated as a magnet hospital. Methodist Germantown, which is where Linda lives, and so does Jill. In that community, we have our Methodist Germantown Hospital. Again, they are on the journey for magnet, but they have one of the largest obstetrical services in the area. They have labor and delivery, they have antepartum, they have postpartum, they have a NICU, a level 3 NICU. Very, very busy operative services, including doing a lot of CV surgeries there. Methodist Olive Branch is the 5th hospital, which is in our system. It is actually in Mississippi, and it's our newest hospital. Again, they do med surg, step down, critical care. They have a very busy emergency department, and they have perinatal services there. So they have OB services there as well. And then we have, as I mentioned, 6 hospitals that surround the city. Our last hospital that I'm going to talk about is Le Bonheur Children's Hospital, again, magnet designated. And Le Bonheur and University are very close geographically. Le
Yes,
Bonheur,
ma'am.
255 bed freestanding children's hospital, again, with a full range of services. They have a level 4 NICU, as an example, with 60 beds. They do heart transplants there, and they just did their 50th heart transplant there. And because of how important it is to serve this region, and we serve nationally as well, they are building on. So enhancing their cardiovascular and their NICU services by adding more rooms, more beds.
Yep.
So that really talks about our hospital system. We have another slide that I'm going to ask them to put up that really talks about kind of what sort of a compilation of all of our facilities and all of the services that we have. So we have 1,600 beds, but again, those are spread over those 6 hospitals. We have 12,000 associates. That's what we call our staff. We have 6 hospitals. I mentioned that. But we have other things as well in our community, and that's that we have physician office practices, we have diagnostic centers, and we have 69 of them. We have outpatient centers where we do surgery. We have post-acute care, home health equipment, home health services, so we do home nursing, and we have a residential hospice and a home hospice program. And I mention all of those because, again, one of the things that we're interested in having you do, and I talked about that in the beginning, is professionally grow with us, is you can see that we have a lot of opportunities, not only within our hospitals, which is where, for the most part, our international nurses start, but as you develop your career, you may want to go to home care, as an example, or go work at our hospice. So that's really one of the value added benefits of working at a Methodist Le Bonheur Healthcare, is that you have a lot of opportunity to grow and a lot of places where you can contribute.
Wow, Nikki, that is so impressive. There's just so much opportunity for international nurses. And I'm just looking in the chat. Brenda's saying my dream place to work is Tennessee. Well, Brenda, come on over.
Come on over.
All the opportunities for you.